How to complete a CMS 1500 form. How to complete a CMS 1500 form. Let's walk through the different sections and individual boxes on the CMS 1500 medical claim form, not including the space at the top of the carrier's information. The form is divided into two sections. The top section includes boxes 1 through 13 and contains information about the subscriber and the patient, and the bottom section includes boxes 14 through 33 and contains information about the provider and the patient's treatment. The CMS 1500 form, and let's go over boxes 1 through 4. In boxes 1, just remember it is an optional section as far as whether or not you select one of these boxes. It's the type of insurance. Now, just please note that you want to select a box if it applies. For box 1A, this is for the insured's ID number. Now, this is a required box. You will enter that member's 11-digit number as it appears on their ID card. Don't use the Social Security number. If you don't know the patient's health plan ID, then you can log on to a provider portal to look it up on, on the facilities portal of whatever your particular provider uses at that time. Now in box 2, that is a required box as well, and that's the patient's name. So you want to make sure you enter that patient's name. And then in box 3, that's a required box that needs to be completed. That's the patient's date of birth. And then in box 4, that is the insured's name. Now, it's not applicable for the most part, but unless you're billing for an infant maybe or a child and you have to use the mother's ID, then yeah, you want to put that parent's name there. Okay? All right. So let's go to the next part of our form, and that's lines 5, 6, 7, and 8. Okay, so in line 6, that's the patient's relationship to the insured. I'm sorry, box 5. Let's go there first. That is a required box. That's the patient's address in box 5 right here. And then in 6, this is where you select the patient's relationship to the insured. If it's self or child, you will select the applicable box. Line number 7, that's not usually required. Only if, again, for an example, if we were using a child, you would enter that insured's address with the same instructions listed for number 5. And then in number 8, line 8, this is not usually required, but yeah, line 8 is not usually required. That is no longer required, and it should have been removed already. It'll say, reserved, but it's not required. Okay, now let's look at lines 9 through 13. Okay, in lines 9 through 13, you have 9A through D. And 9A is other insureds policy or group number, and 9B and C is reserved, and 9D is other insurance plan. So these fields are not required, so you don't have to worry about that. Lines 10A through C, that's the patient's condition. You can check one or more categories in this area. And if you look at the screen, that would be right here in the middle, 10A, B, and C. You might want to mark yes or no if the person is employed, or if they've been in an auto accident or any other type of accident. And this is important because we have a workers' comp claim. You want to know if this is workers' comp or if this is an automobile accident. So that's important to check off. Now, in lines number 11, this is the insured's policy group or FECA number in line 11, and that is required. Oh, yeah, well, actually, it's required, but it's not usually something that is entered, but that would include the group number or FECA number. You wouldn't use any hyphens or spaces. Even if they appear on the insurance card, just make sure you don't use those hyphens. Now, it's important to note that this applies to any auto accident or other coverage that may have happened as well, if you fill out block 11. Now, block 11A and B, that's if they had an auto accident or other accident for workers' comp. You're going to put in that insured's date of birth and sex. For 11B, that's that other claim ID. Usually it's not something. Is that 11? I'm looking at 11B. 11B is not required. 11C, only if applicable, you want to put in the insurance plan name or program name. For 11D, if there is another health care benefit plan, you want to mark it yes or no in 11D. Okay? And then in space number 12, if it's available, you want to enter the patient's signature. You want to have the patient to sign there. But if a signed document with the patient's authorization for release of information is in their chart, you don't have to have the patient to sign, because if your form is automated, it should say signature on file, or it will say SOF if it's permissible right here. Okay, and then item 13, that is usually required only if available. The same thing, you want to enter the signature of the insured, and if they have a authorization for payment of benefits in their chart, then you would use signature on file or SOF. If the original insured signature is entered, then the date signed must be stated in block 12 as well. All right. All right. So let's move to blocks 14 through 18. Now, blocks 14 through 18, 14 is the date of current illness or injury, and it is required. say for instance, you come in to your doctor's office and you said you had an earache. And the doctor asks you, okay, so what date did this start? And you can say, oh, it started about a week ago. So the doctor is going to put in that particular date of that current illness or injury. So you want to make sure block 14 is complete. Block 15 is another date, and that's just an additional date related to the patient's condition or any other prior treatment that the patient may have, and you would put in, the month and date in year format for item 15. And when you put that in, right here in the code, you would put in a code saying why that date is there. You have to put in a 3-digit qualifier to determine which date is being reported. I mean, the date could be, the date of the last x-ray, or the date of the accident, or the date of the prescription, or the initial treatment. There's a list of codes that has all of this information, and it's actually on your claim form. So you will have that information to put on there for that particular date. Okay, so item 16. In item 16, that those are the dates patient unable to work in current occupation. Typically, this is only indicated for accidents, like I said, for workers' comp. So only if applicable, you will enter number 16 for the dates there. Block 17, that's only if you have a referring provider or other source. You would enter that full provider's name. I've worked in facilities where most offices had referring providers, and so we have to put their referring provider information in. So it would be either the ordering provider, the supervising provider, and you would enter, whether it's you would first enter their first name, middle initial, last name, and what their MD is. And if it's filed electronically, the degrees should not be on there as far as MD, but if it's manually, you would put MD. Okay, so 17A and 17B is right here. That's the ID number for the provider, if applicable. And then block 18, those are your hospitalization dates related to the current services. So for patients that were treated in a hospital, you would enter that admission and discharge date in that month, day, year format. And for example, this is if a patient had a work-related accident or an automobile accident, they got put in the hospital, but they're coming up for their follow-up visit, then you would enter their hospital dates so that that doctor or that insurance company knows that, yeah, they were in the hospital and this is why they're back into the doctor's office. All right. So let's go to talk about item 19. And we're going to talk about items 19 through 23. So in items 19 through 23, 19 is usually reserved for local use. Say if you're adding some attachments or some additional documentation to the claim, it's important that descriptions be used instead of the documents because they have to be coded. So you want to make sure that if you're reporting the type codes, you're either using there's a list of type codes that you can use, which could be drugs administered, our treatment of diagnosis, our plan of treatment, progress report, or some type of continued treatment. So you want to make sure that you are doing that when you're listing something for item 19. Let's look at item 20. Item 20 is outside lab and related charges. And for outside lab and related charges, just note that if you have multiple labs, a separate claim has to be used for each purchase service. And you're going to enter that amount in the field to the left of the vertical line. So that would be item 20, which would be right here for outside lab. So for item 21, that's a diagnosis or nature of illness or injury, which is this block here, item 21. And this is where your ICD-9 codes, or I'm sorry, ICD-10 codes would appear. Your ICD-10 codes should be prioritized from the most important problem being treated to the last significant one, such as if you go into the doctor's office and you go in for a code, but while you're in there, you tell them about a spider bite that you had on your back of your leg. So that your code would be priority, the spider bite secondary. You would list any codes that was related to that patient's illness or injury while they're in the office, okay? And then for item 22, item 22 relates to, and let's go back here. Item 22, that one is resubmission and original reference number. If you're submitting a claim, you want to state the original reference or claim number. That's a single-digit bill frequency code that's entered as a 7 or 8, because a 7 is a replacement of a prior claim, an 8 is a void or canceled claim. So you would only use that only if you have to use it. All right. So let's go to fields 24A and 24B. These are the most important parts of the claim. Then this is where you would enter your dates of service for 24A. You would enter it in the month, day, year format. And if the services are provided only on one date, they would include only one. Well, it would be indicated only in the first from column. Now, if services are provided on multiple dates, then you would have a 2 date. So just remember that. And then 24B, that is your place of service codes, and that could be used by a lot of different providers, and I've given you some examples here, and this is not inclusive of all of the codes, but it would, be school or home or in the office, at the doctor's office, or that's another home code, but the first one was homeless shelter that I was looking at. And then inpatient hospital, outpatient hospital, if the services is done in an emergency room. I mean, they could be services done at multiple different places. So like I said, this is not the full list of the place of service codes, but you can find that list in your ICD 10, your CPT, current procedural terminology book. They have a whole list of the place of service codes. Okay, so for 24C, that's your emergency room treatment. You want to put yes. next to each medically billable procedure provided on an emergency basis. That's only if you have a place of service for emergency. And then 24D is coding services. And I'm not sure if you can see this, but it's 24D. That's where you're going to put any CPT or HCPCS code that is needed to bill for the patient. 24E is required as well. That's your diagnosis pointer. That's the code that you want to put in to say, okay, this particular diagnosis relates to the code that the person came in for, or the second diagnosis could relate to that spider bite that patient had. 24F, that's your charges. Your charges is in 24F, and they would go here. Anything that, was allowed as far as if you bill a code, you might charge $100 or, $20, whatever the charge is. And then 24G is your days or units. And so, for instance, say if a person came in to the emergency room, well, no, that's not a good one. Say if they came in to an inpatient facility, say the doctor did a visit to the patient, and they did it for 2 days. They would put their number of days there. Okay? All right. So again, for 24D, this is for your procedures, services, and supplies. And this is just some examples of the commonly used modifiers, because you might have to use a modifier on your CPT code. It can be a modifier for surgical procedure where a procedure is performed was less involved in the CPT prescription or description. So modifiers can be found in your CPT coding book as well. And these are the examples of those commonly used modifiers. Okay? All right. So our next items are 24H through 24J. And 24H is primarily only used if applicable, which is this column here. And it's only used, you would put a code of 1 or 2 if the services rendered are related to family planning. Okay? So 24H, which is right before that, 24H is, if it's relevant to oral or dental claims. So if you're working in a dental office, you may use that particular field. 24J, again, 24I, I skipped one. So you have 24H and then I and J. So going back, 24H is family planning. 24I, you would enter an X if it was emergency services. And 24A is if you had, 24J is if you had a rendering provider ID number. Okay? And that's here. H, I, and J. All right. So 25 through 31, we're almost getting to the end of this claim form. And it's a lot of information to cover. However, if you utilize this resource, it will help you as you move forward in your future career. Item 25 is the federal tax ID number, and that's where that will go. It will be the federal EIN number. And then item 26 is the patient's account number. You always want to make sure that account number is there so that they can bill the right patient. Item 27 is whether the doctor accepts assignment or not. Most of the times, if they accept Medicare allowable, they do accept assignment. And then items 28 and 30 is where you're going to put in the total charges. Now, if the patient pays something, you'll put the amount paid. And then signature, our physician or supplier. That's item 31. And that's where that signature of that provider will go. And I just wanted to show that again. Okay, so let's move to items 32 through 33B. Item 32 is service facility and location. So that's where you want to put the name, address, city, and state of your provider. And item 33 is the provider billing information. That's where you would put the individual provider name, their address, and city and state. Now, if it's a group of providers, you will also put that group practice name in there and their address and city and state. And then also you want to, at the bottom in A, you want to put that MPI number for that provider. And then in B, if they have a non-MPI number, but they have a state license number, you want to put that in the item B. And the same goes for 32. If they have, an MPI number, you want to put it there. Okay? So that concludes our components of the CMS 1500 form. You can refer back to this reference, and I encourage you to use this as a resource in your future career. Thank you.